Uh, what is your name?
My name is Terry Jo Rosinski.
Okay. What is your job title?
I am the clinical coordinator of the physical therapy clinic at the Campus Health Center, and I am the staff athletic trainer for the men's baseball team.
How long you work here at your job?
Well, I've been at UNC for 13 years. I've been with baseball for 11.
How many hours do you usually work every week, or does? Yeah.
Hi, Coach Jackson.
How are you?
Good. How are you?
Good.
So how many hours do you usually work every week?
How many hours do I work every week? I try not to count them. I'm going to say it's probably around between 60 to 80, about 60 hours a week probably.
Does your schedule look like?
Well, I see patients in the mornings up at Campus Health, usually till noon, and then I'm down here every afternoon. And then I cover games, or travel with them.
What are your responsibilities and duties at where I work?
What are my responsibilities at work? Well, I am in charge of taking care of their injuries. So preventing injuries with giving them programs to do, or fixing injuries with treatments, exercises, and I do the same thing for the general students up at Campus Health.
What is hardest part of your job?
The hardest part of my job? Probably, the hardest part of my job is probably not allowing somebody to participate if they can't. That's probably the hardest part of my job. Or if someone has to have surgery and they can't participate anymore.
What do you do at your job is different every day?
Well, my job is different every single day because it just depends upon what happens with the guys. They might have different muscle injuries every day, or they might be sore differently based on what they did. They could have some abrasions from the game. Basically it's changing every single day. Some of the kids that are hurt, that are rehabbing, they're pretty much set on a schedule, but we have other things that walk in every day. Some kids might be sick that we have to take care of, etc.
What do you like most about your job?
Working with the student athletes, and getting to see somebody participate again after they've been hurt.
Do you enjoy working with your coworkers, or do you like working alone?
I enjoy working with my coworkers. Well, down here, the field crew, everybody kind of works together, the coaching staff. So I'm very fortunate. I love everybody that I work with here.
Okay. Who has been a major influence in your life? How have they helped get where you are?
Well, I would have to say Dr. Dan Hooker. He's a physical therapist, athletic trainer. He was one of my mentors when I was in graduate school here, and he was one of the leading forces to ask me to come back to work here. So I feel very fortunate, and I'm fortunate enough to have him in my life and to kind of mimic my life after his, with his career paths and family, etc.
Do you have any advice for me or anyone else looking to get your job?
To get my job, well, you have to really like what you do, because if you don't like what you do, it's hard to come to work. Again, the hours are long, and you have to sacrifice things sometimes in order to do your job. So I think you just have to find a career path that you like and find a job that you love, so you don't really have to work another day. But you have to get good grades and do well in the sciences in order to get into this field.
Do you set any goals at your job? If so, what are they?
I set goals every day to try to get people better. So, you know, if I can't find a way to, if I can't get somebody better, then I need to find another way. So I'm always trying to learn at my job, try to set new goals and learn new things. I just learned how to dry needle this last year, so it's been a huge game-changing treatment for down here, especially.
Why and or how did pick your job?
Well, I wanted to work with motivated people, and I wanted to do something in the healthcare field. So I went into athletic training first, and then after working a while, I went back and got my physical therapy degree. But I wanted to work with active populations to try to get them well.
What other jobs you have? You had?
Well, this is pretty much the only job I've had. I've worked in a clinic right when I got out of graduate school from here. I worked in a clinic in Milwaukee. I worked with the Milwaukee Ballet Company, a semi-pro football team, an indoor football team. I've worked at a high school level, a junior college, and a clinic in Madison. And I also did 6 months of hospital rehab setting, inpatient, outpatient. I've done a lot of different things, but like I said, I've been here. They've all been directed around athletic training somehow.
What is your favorite sport?
Baseball.
Do you play any sports?
I played a lot of different sports, but I'm not good at any single one of them. But I liked volleyball and softball and swimming, a little bit of tennis. I can do a lot of different sports, but I'm not really good at any of them. That's why I went in the role that I went into.
Thank you for your time.
You are welcome. I'm sorry it was confusing getting here.
Fine.
Is this for a class you have to do?